Let's talk about low back pain. There are 2/3 of the American people will have low back pain at some time in their life. That's 67%. Now, the good news about that is that in 2 weeks, most of those will be over their low back pain, and within 3 to 4 weeks, they won't have any symptoms at all. However, 1 million people take time off from work because of low back pain. It costs, because of medicines, physical therapy, recovery, work days lost, it costs the United States about $50 billion every year. So it's a very, very important topic. What causes low back pain? Well, low back pain is part of the back, obviously. There's a cervical spine in the neck, and then there is a thoracic spine in the chest, and then there's the lumbar low back, 5 vertebrae. Nerves come out of those vertebrae and supply sensation and muscle activity to the lower extremities, to the legs, also to the bladder and to the pelvis area. If one of those nerves gets irritated, we get low back spasm. And when we get spasm, the muscles in the back even pull those vertebrae closer together, and so they keep irritating that nerve until we treat it appropriately. What is the treatment for low back pain? Well, when you get an acute episode, sudden onset, then what we do initially is we get in a position of comfort. There's an old wives' tale that you need to go to bed if you've got low back pain. That's not right. You get in the position that's the most comfortable to you. If that's standing, stand. If that's sitting in a recliner, sit in a recliner. When you get in bed, you'll do better if you get sort of in a hunched up fetal position. That takes the pressure off of those nerves. First 24 hours, we usually apply cold, 15 minutes on, 30 minutes off, 15 minutes on. And if you can rub that cold in there, it begins to numb the muscles in the back and lets them stretch and relax a little bit. After the first 24 hours, then we use heat. We become active by listening to our body. If we can get out and walk, or if we can stretch a little bit, we should do that. No lifting, no running, no pounding, no sudden movements. Your body will tell you what you shouldn't do if you listen to it. And then we get anti-inflammatory medicines, ibuprofen family of medicines, or aspirin medication, or even Tylenol, not as good anti-inflammatory, but good for pain. And so you use those medicines to try and cut down on pain, and then you wait. If this pain persists for longer than a week, then you need to talk to your doctor. If you want to talk to him early, your doctor will think about other causes of low back pain. Could be kidney pain, it could be some female organ pain. There are other things that cause low back pain. If you've got fever, or if you've had weight loss and you get low back pain, more of an emergency, call your doctor right away. But know that most people, 80%, at the end of 2 weeks don't have any back pain at all. Who should you see best? Well, studies have shown that orthopedic doctors are not much better than family doctors, that are not much better than chiropractors, and maybe your pharmacist will give you simple advice. See the doctor that you trust. Get a plan with that doctor. Now, if your symptoms persist, then you certainly want to see your family doctor and orthopedic specialist to look for other causes.